Hi guys, my name is Thabitso. The surname is Khumalo. I'm from Absolute Health Services. I work as an instructor. Today we are going to be talking about first aid and specifically shock. How to recognize it, how to treat it, and how to deal with it in an emergency situation. So firstly, first aid is an essential skill that can save lives, and knowing how to respond in a medical emergency, especially when someone is in shock, can make all the difference. Shock is a serious condition that requires immediate attention, yet many people aren't aware of the signs and symptoms. This guide will explain what is shock, what causes it, what signs or symptoms does it present with, and how to treat it. So with the definition, we define shock as a critical medical condition that occurs when the body is not getting enough blood flow. This will further lead to vital organs not receiving oxygen. Therefore, it is the body's response to severe stress and can be triggered by various factors. Hence, medically, it is defined as an inadequate supply of blood and oxygen to all parts of the body. So let us quickly look at the different types of shock and their causes. We've got an anaphylactic shock, which is caused by severe allergic reactions. We have septic shock, which is a widespread of infection. We have hypovolaemic shock, which is a loss of blood and of fluids. We also have neurogenic shock, which is a result of spinal cord injuries. In addition to this, we also have obstructive shock, which is a blockage in the blood flow. And we also have the simplest or layman's definition of shock, which means it's a medical term that involves the body going into a state of emergency to maintain essential functions. Knowing the different types of shock helps one understand how to respond. How to respond. So quickly looking into the causes of shock, mainly or commonly we've got blood loss from external injuries or wounds, and also internal injuries, which leads to hypovolemic shock. We've got heart attack causing cardiogenic shock. We have severe allergic reactions, which affects the airway, the breathing, and the circulation. Infections as well, spreading through the body, leading into septic shock, and spinal cord injuries resulting into neurogenic shock. How to then recognize if a person is going into shock? Let us quickly look at the signs and or symptoms of recognizing shock. Number one, shallow breathing, a rapid with pulse, pale, cold, and a clammy skin, loss of consciousness or fainting, anxiety, agitation, or confusion. Other symptoms will include cold extremities, where your person gets feel cold on your legs and your arms. And we also have a weak pulse. The blood pressure is eventually going to drop as well. And recognizing both physical and psychological indicators assist in providing necessary first aid. What do we do then in terms of treating and stabilizing these people before emergency services arrives on the scene? So mainly, we have to move our patient into a place of safety, of course, lay them down in a supine position, and we elevate the legs 15 to 30 centimeters or 12 inches. You want to keep your patient warm so that we can maintain the body temperature, covering them with blankets or even clothing. Make sure that help is on the way, of course, by dialing 112 or 10177 to get hold of your ambulance services for the state ambulance services, or if you have access to the private emergency services, you can also dial that. Monitoring the patient's breathing and pulse, and starting CPR if needs be. So continuously, almost every 5 to 10 minutes, you're going to have to check that the vitals, specifically the pulse and breathing, are still intact. Reassuring your patient, calming them down, and in severe cases such as major blood loss, heart attack, or spinal injury, it may require medical intervention like blood transfusion or intravenous fluid, which is, of course, after handing over your patient to the advanced medical services. Those are the basic steps to follow when it comes to treating a person that is in shock as per first aid, and very important that we remember to stick within our scope and level of training.